Hey, ho! Okay, we are back. We are going to be educated. Wait till you hear what these guys have to say. From Dayton's Interventional Radiology, our first spokesperson will be Dr. Mubin Syed, everybody.
All right.
Hey, ho!
Welcome.
How you doing, Doc?
How are you?
Doc, good for you. Some doctors don't want to be called Doc. I say it out of respect.
Oh, that's fine.
Okay. All right. Mubin Syed. I think I got it right, didn't I? Mubin
got
Syed.
it. Yeah.
And your specialty is with the organization?
I'm an interventional radiologist, and we provide treatments for many patients, literally from head to toe, of many new, exciting, innovative treatments, a lot of which address the idea of pain and helping patients who provide a non-narcotic solution for their pain and even for vascular disorders. There's all sorts of conditions that we can help, over 200 procedures.
But medication just how do I say, temporarily smooths it over, but that's not going to solve the problem, medication.
We like to think of what we do as actually fixing the underlying problem. Yeah.
And you specialize in back pain and...
Yes, back pain, lower extremity pain or leg pain. We even treat neck pain and headaches as well.
Unfortunately, I think the media has brainwashed us to think the only way to get rid of that pain, they got to get you in the operating and cut you open. And unfortunately, as you well know, in doing what you do, that in a lot of cases, maybe most cases, is not really necessary.
Right. With today's modern technology, you can actually use X-ray and even ultrasound vision to look through a patient's body. You don't need to cut people open. You can actually look through it, and you can use tiny catheters and wires to do things that would be unimaginable and open up blocked arteries. You can treat the sources of pain. You can even treat fractures without even touching the skin.
In your procedure, is stents still part of that procedure? Or is
Yes.
this something different?
In fact, stents were actually invented by an interventional radiologist.
Wow, that's impressive. Did you hear that?
The concept of angioplasty, same thing.
Wow.
It's actually, the innovations of this field have really revolutionized medicine.
I think years ago I heard, and they've redesigned the stent, that the older stent, which are not using now, almost attracted the plaque, where the new one does not do that. Am I remembering this correctly?
You might be talking about the concept of a drug-eluting stent. It's coated with a special drug that prevents the blockage from
It actually went in the
back.
vein and went like that.
And there's even now covered stents that can actually physically prevent the blockage from coming through.
Of all the procedures you do, is there a certain one that your patients that come in, you do the most often? I'm thinking back. I mean,
yeah, we treat a lot of back pain, and whether it's acute or, you know, been there for many years, we call it chronic, and there's ways to do it without even using medications. There's with technology now and high computers, you can actually tailor the treatment electronically to remove the patient's pain. So it's really exciting.
And how long have you been doing this? And how did you get involved in these procedures? How did it all start with you?
Well, you know, when I was in medical school, there was a rotation that we rotated through called radiology, and there was one doctor there that did these really amazing things where it was almost heroic what he was doing, and it really amazed me that he did not have to cut open a patient to do it. He did everything almost like a video game, where he would use tiny guide wires and catheters, and literally through an IV he could do the most amazing things that would require major surgery.
And you kind of liked all that. It kind of spark in you.
It was really exciting, very thrilling to see that type of stuff go on.
And your organization's right here in Dayton. That's
Yes,
why it's called Dayton Interventional Radiology.
We're the only outpatient or freestanding center, independent of a hospital, that provides these interventional radiology procedures.
And in most cases, I think you said that you can be out the same day.
Within a few hours.
Wow. Remember the old show, $20 Million Man? It's here, isn't it? It's here. Remember, I said recently, we all watch Star Trek, and you go, bridge. Yeah, right. You're going to touch a little emblem and talk to the bridge? Bluetooth, hello. It's all here.
Yeah.
And it gets more exciting every day.
Every year there's new treatments that are coming forward in interventional radiology that really can boggle the mind. It's a very exciting field.
I just honored nurses. I had a nurse here on the last show, nurse 15 years. If there was a channel that showed you every possible operation they can do in that camera, because the new cameras now is up here in the glasses when doctors are performing surgery. Any type of what you guys do or anything surgery, I could watch it 24 hours a day. What they're doing today in medicine, what you guys are doing is certainly an innovation, what you guys are doing. I appreciate you coming. Thank you.
Thank you.